Joining us now is public health expert Tui Mebaundu, who's a medical doctor. It's good to have you join us right now.
Good morning.
Well, just yesterday we were talking about this with other people and even including yourself, but here we are now talking about the real substantive first case of coronavirus in Nigeria. Now, you are in that space. Talk to us right now because, and I've, in fact, on Twitter, for instance, through the whole night until now, there seemed to be some level of panic already.
Again, the important thing is not to panic, because I don't see what panic would do. What it seems like right now is that the coronavirus is like unstoppable. I mean, we can't deny that. 48 countries, Nigeria +1, that is 49 countries. And we've seen how it affected more than 81,000 people, causing as much as 3,000 deaths. In fact, unfortunately, there are some aspects of this coronavirus we don't understand, because we've seen mystery transmission in places like California and Germany, you know, where those people don't even have contact. You cannot say they have contact with someone with coronavirus. We've also seen people that are not well, doing well, and in reality positive for coronavirus and can actually transmit the virus to another person. So what do we do? Of course, we've gone beyond the fact that, what can we're doing temperature. Yes, we need to do temperature, but again, all we need to do is to have that high level of suspicion and sterilization. And we need to keep telling people what to do about their hygiene, how to maintain respiratory hygiene, how to keep on hand washing. And because, again, even with all China did, try to curtail the virus, we've seen that it failed. Because, you know, all the China did at Wuhan, so that the thing went all the way, got to Italy. 10 cities in the northern part of Italy are on lockdown. Still, all the Europes are picking the virus. Iran cancelled Friday prayer. Saudi Arabia blocked anybody from coming to pilgrimage. So, you know, the thing is really affecting us and everybody the way it is. And the greatest fear now is this. This is the part of the world that the health system is actually fragmented. How do we deal with it?
So what will be proactiveness on the part of not just Lagos State government, but Nigeria as a whole at this point, because we can understand the way it spreads very fast?
Now, again, yes, we need to be proactive. We need to be, you know, high index of suspicion. We need to keep screening. We need to inform our people what they have to do to ensure that they don't pick or transmit this virus. The health institution needs to be strengthened in such a way that, even the private level, you know, this is the standard you need to maintain so that you don't pick the virus and transmit it to another person. Of course, as usual, we just wait and then hope that the virus, you know, simmers down and attenuates, and people can then now go about their ability. What I see, you know, unfolding is a scenario close to that of cold virus or influenza, cold flu or influenza, because you know, the fatality rate of the virus is very small. You know, China's estimate says about 2%. Well, but what we say is that even people may not show the virus but can transmit it. And what are we waiting for? Are we going to see another mutation to another thing next time? Are we going to see development of vaccine to fight this coronavirus like flu? So
now, one area that one wonders is that there are some persons who contacted the virus and got well.
Yes.
Then there are others who got it and died. So what circumstance can one get well, and what circumstance can one get well, or become fatal?
It's a complex thing in your immune system, why some people get sick, why some get well. Now, but let's understand the risk factors in this disease. One, age. You know, the older, the worse the situation, the outcome of the virus in a person. Secondly, ongoing chronic illness. That's the second thing. Thirdly, your immune system and body constitution. These are key factors, because we found out that quite a lot of people with chronic diseases, quite a lot with malnutrition, they tend to have, you know, an exaggerated response to this virus. Okay, so but generally, with the immune system that is strong, the body tends to respond and battle it. Of course, you know that as much as, I mean, we are thinking about just 5% that will actually be very sick, but 5%, that's the figure. 5% in human being is a lot of people. So, and then unfortunately, we've not really have a deeper understanding of the of the natural history, how this virus gets to spread from one person, how we got to the mystery transmission that we don't even know somebody with that contact. Are we having different flares from different countries then forming together, because now we are now more conscious of the virus and testing for more. So, but for us in Lagos, for us in Nigeria, we know Lagos is the center of Nigeria. We don't want to get to a point where we have to do a lockdown. We don't want to get to a point where people have to go to school and say, you know, let's cancel school. Because it's important that appropriate message should be passed to institutions like schools, like market, like events. You know, we like to do parties a lot.
Oh, yeah.
So we need to pass the appropriate information on proper conduct of those things so that we don't then have a situation of Wuhan in Lagos.
Thank you so much, Dr. Tuyi Baondu, for your insight into this. Thank you.
My pleasure.
All right, joining us now, public health expert Tuyi Baondu is here with us in the studio. It's glad to have you join us.
Good morning.
Thank you.
Now, one challenging area that we look at is the issue of tracing
Contact tracing.
contact persons that someone like this person now had contact with. How challenging is that when it comes to tracing who you have contact with? Either you shook hands or sat down or something.
Very quite challenging, especially in a place like this where we don't have details understanding of movements and how it can impact on people. Even in other places, it's quite challenging. But again, and then even the issue of trying to quarantine people or what we call restriction is getting out of, because again, it gets out of fashion because...
Really?
Yeah, in reality, because wait a minute, look at what China did at Wuhan. They actually locked down 100 million people. Flights were not going anywhere. Schools were closed down. Despite all these measures,
It's still spread.
the virus burst out and
Yeah,
escaped to all parts of the world.
Would it not be better in that way? Because when you allow people to move, when they become too mobile, for instance, it could have been worse. Maybe one would say it could have been worse if flights were allowed to run and people were allowed to travel the way they were supposed to travel.
Because at the end of the day, for instance, let's look at what happened in China. China is a key supply chain company, manufacture a lot of things. Even the medical supplies got in short supply, okay? So we must be able now to think that what can we do at the level of community? Because, you know, I have to mention this because you look at Nigeria, you know, if you're going to do restrictions, it's going to be quite challenging in Nigeria. If you're going to quarantine, you have challenge with the health system, human resource to do those quarantine, and all that stuff. And then, of course, we don't self-report ourselves, you know, like we saw in the case of that Italian that came to Lagos. Then the next question is this: what are the possibilities? What are we supposed to do that can further curtail this virus? What are the, you know, what are we supposed to do in the community that can help us to, you know, curtail the spread? Okay. Now, we have, you know, because the spread happened in a place where a lot of people interact. We do parties, you know, every weekend. There are schools, there are churches, you know, there are event centers and all those things that tend to enhance human interaction, as it were. And then even at that, we have a lot of complications. So many things will look like coronavirus. Even dust in the environment can make people sneeze continuously, and then you will not know which one is corona, which one is not corona. So now, we need to really re-emphasize those things that will keep us, you know, at least free, even while we're interacting with ourselves. Of course, we've talked about what we call social distance between you and people. You have to maintain it. People have spoken about hygiene, nice, you have to maintain it. You have to really be able to have deeper understanding, because if a child is sick, for instance, you then send the child to school, that's the question. Do we have a guideline given to parents on how to look out for a child that is sick? Now, there are a lot of transport hubs in this Lagos that we then enter transport. Do we have an information on how we should react at those transport hubs, what you should need to do? So these are core things that we need to attend to. No doubt, the COVID-19 has done a lot to the way we live our life. It has impacted on so many aspects of human living. It's not about religion again. It's not, business is suffering. And then you can see that even the world may have what we call, depression because of all this.
What scenario do you see playing out, especially how it will affect our lives if we do not curtail the spread as soon as possible?
Well, it's going to be quite challenging, because we hope that, the virulence of the virus is not this high. It's not that high, because when the H5N1 came out, it has a very high fatality of as much as 60% people that contract the virus will die. But this one, lucky enough, 2% contracted and died. But interestingly, a virus with that high impact of fatality can easily be curtailed because somebody picks it, you quickly see it, and then you say, okay. But the one with this that is smoldering, that is, gradually can spread far and wide before it gets, noticed. Now, so what we do is that those public spaces, because it's going to affect the way we live our life, let's face it, the earlier we start, signaling, the earlier we start talking about it, the earlier we start educating people on, in the market, in the school, at the bus stop, and tell them, if you see anybody that is sick, and then even our health system, the earlier we involve every part of health system in looking at what could be the COVID-19, and more importantly, how do we do the testing? For now, we have Lagos University Teaching Hospital. So now, there must be a simple algorithm that can help us define that could this be a COVID-19 case or not. So the simple algorithm may not necessarily have to do with defined testing, but that helps us to have high index of suspicion and be able to refer the person appropriately to where it's necessary.
All right. Dr. Tuyi Mebaondu, thank you so much for your insight.
Thank you.
Thank you. All right. The ministry, the federal government, and even Lagos state government are, because I've seen tweets from the authorities saying there's no need to panic.
Absolutely.
That no one should panic.
And the NSCDC recent tweets also talked about training, health officials that will be in certain areas. About 5 states in the country, high-risk states, as it puts it, to ensure that they are well equipped to handle any outbreak. And it's a good thing to note that Nigeria has stepped up the plate with regards to preparedness. Joining us now is public health expert Tuyi Mebaondu. Thank you for joining us on TVC Breakfast. All right, now, by way of education, because a lot of Nigerians, Lagosians, are panicking, what can they do by way of prevention, preventing themselves from contracting this virus?
Again, I don't think panic is the right reaction. First of all, we need to calm down, okay? Because, that helps you to put things in perspective. Now, first of all, you need to look at what you can do for yourself. Because if you look at 20 million people, and we're having so many things to contend with, and here we are, we have coronavirus, a single case of coronavirus. If we panic, we're going to actually misbehave. First and foremost, we've studied over and over, have a high index of suspicion. Embrace your hygiene as much as possible. Simple hand washing. People tend to push for face masks because we look at it that even face mask, that means that you have to throw it away severally because after sneezing you have to throw it away, you have to then go and wash your hand. So if you are not having such an active illness, why do you then have to put on a face mask? But if you are sneezing, you are coughing, you need to put a face mask to protect other people you come in contact with. So apart from the hygiene, the social distance, okay? But invariably, we may not be able to maintain this. We go to church, we go to market, we're at the bus stop,
and even
we go to party. Yes, that's, we go to religious gatherings, okay? But let us appreciate the fact that even in a place like Saudi Arabia, they have to cancel pilgrimage, which is very core to them. In a place like Iran, they have to stop Friday prayer because they know they don't want to spread the disease. So please, let us always put the health above any sentimental or spiritual consideration so that we don't then spread the disease. Thirdly, what we call respiratory hygiene. In such a way that if you need to sneeze, since that you're able, you have an handkerchief that you can throw away or tissue paper you can throw away to get it done. Now, self-medication becomes a problem here because if you then self-medicate, you are going to miss a lot of simple things that can show that the person is having the disease. Let us note that the virus is reflecting in different ways. We've seen people that are walking all over the place that are still positive for the virus in other parts of the climate. We've also seen that, older people, people with chronic diseases don't tend to have the virus. So generally, we need to pay attention to our health, because when the thing comes, and we don't want our health system to be overwhelmed. If our health system is overwhelmed, we will not be able to respond appropriately.
Let's focus on the medical personnel, the nurses, the doctors who are the gatekeepers sometimes to detect some of these things. Now, when you get to the hospital for any ailment, for instance, there are times where they check your systems, they check your pulse and all of that. All these, there are direct contacts here and there. Now, how much of enlightenment has gone into the medical personnel who are the ones to, deal with the people and handle the people on a daily basis?
A proper hospital setting understands what we call universal precautions.
Okay.
There's a universal safety and precautions. It's a standardized process of handling, not just even in cases of the epidemics like this, but also in every situation. What you should need to do, where you have to wear your gloves, where you have to minimize contact and face mask, where you have to actually do, a thermal temperature instead of the usual thermometer temperature. So what we need to do is heighten or increase such thing, because we look at the health system to be able to provide guidance, for people, not just for their workers alone, for people that come around to seek treatment, so that at least they can be informed appropriately. So there's nothing wrong, because I know that there are websites, even different states. I'm sure Lagos State is also doing it. Hefama is doing it, trying to send the website to you where you need to do what you need to do to assure your universal precautions. Different medical associations, either in states or local government, can also enhance that. The public domain, I'm talking about the public interaction, we should have quite a simplified information that can help people understand what to do in terms of prevention, any epidemic or any epidemics at all.
All right. To you, Maybe I want to thank you for speaking with us.
Thank you for having me. Yeah.